Hi, Kelly. I'm so glad you're able to pick up a quick call with me. And I know how busy you are right now. Your work is awesome. But here's why I reached out to you this time, which I love reaching out to you. But we started this really strong partnership with University of Washington School of Nursing, my alma mater. My world is somehow getting closer to you in some ways as a nurse informaticist. Our virtual nursing platform, our virtual nursing, when we talk about it, is synchronous audio and video visits, with someone in a remote place or a nurse in a remote place, and a patient on site somewhere. And in working with sim labs, it has been, both, accredited and non-accredited sim labs, but practicing nurses actually simulating the practice of virtual nursing that they will expect to be practicing in once they graduate, since 60% of our nurse execs are planning on doing this. I loved your talk so much, and I know I've quoted you a bunch of times on your talk from ANIA, but when I was able to catch your attention after it, you were talking about the work you had done with MIND, or is it MIND or MIND with Vanderbilt? And I would love you to catch me up on this work. It's brilliant, I know it, but I want to hear more from you on this work that you're doing.
Yes, and I am happy to share that with you and anyone who's willing to listen, because this is a topic about mental health for nurses. So the idea is MIND, meaning Mindful Immersive Nursing Demonstration Lab. So it comes back to, what are we doing in education, in academia, to help support our new nurses, our young nurses, however you want to phrase that term, but to actually embed some, what I call prescribing technology for themselves. So they look at simulation as something maybe separate, which is an activity that they have to repeat and build competencies. But where we're looking at it, so the director of simulation here at Vanderbilt University School of Nursing and myself, Dr. Joellen Holt, we have really kind of partnered up on this concept to say, we really think that using technology within simulation is the way to go. But you need informatics and simulation together as a collaborative to make the whole concept successful. So simulation experts right now, I'm just going to be really frank, are not really embracing informatics.
Okay.
Which is so confusing, because simulation is all about using technology, the advanced dolls that throw up and do all kinds of crazy stuff. Those are technology-driven dolls. Years and years ago, while I was practicing as a CNIO, I had a student from Vanderbilt. So I was always a preceptor. So here's my plug, be a preceptor. I need more preceptors. So I was a preceptor for a student here at Vanderbilt, and she actually ran a simulation center. And she wanted to know more about how to do the technologies. She went to school to get her informatics degree as a simulation person. So
Awesome.
there's a whole thing there. So the idea was, I've always been fascinated with gamification to make people happy. Okay. And so how can we actually, and there's a thing to it. People want to deny that gaming actually makes you happy, but there's a ton of research out there showing that Candy Crush, or a minute of, doing a puzzle, or just that whole break from reality where you immerse yourself in a game, it brings you joy. Okay.
Oh yeah.
Let's just
We're
say
a piece in a pot on that. I have my Nintendo Switch, and I have a
there you go.
fantastic island on Animal Crossing.
There you go, right? And
yeah.
so, like, my husband and my kids, who my twins no longer live with us, they live, right, they're graduated from college, they get on Fortnite together and game together. So like, these are communities, they're inclusive communities. And I was listening to a TED Talk one day, and the guy was saying, gaming for opioid addiction, what's the connection? And I thought, well, that's a weird one. So I started listening to it, and I was hooked. I was really fascinated by his techniques. He created an entire virtual reality space that people can go into and actually work on social, mental health therapy and counselings. It was fascinating to me. So I stalked him and I got him to come here to Vanderbilt. And so we worked a little bit together there. But the idea is we went from asking some nurse practitioners, hey, can you put a headset on? And then we put them in an aquarium.
Okay.
And like an octopus floated by, and they were able to use bubble guns and stuff like this. And they were so engaged with this concept. And there were 60 of them, these nurse practitioners. So talking about simulation and the challenges there. So we were like trying to introduce technology there. And I had to do it, from an academic perspective. So we used a model, technology acceptance model, to see even something that is going to be useful. And so they all hands down said, do it. This is a big deal.
Okay.
And this was like 3 years ago. They were like, do this. I can prescribe this to my patients. I know my patients are using it. So that was the idea. We want to get them to know, do you know that your patients are actually in these online communities seeking therapy? And maybe you should think about being aware of that, but also what can you do for yourself, for nurses' mental health? So we started really taking this seriously, and we've grown this whole immersive virtual reality lab to be the mindful immersive nursing demonstration lab. So that's where the mind lab concept came from. So
wait, let me level set
Yeah.
on, because I'm hearing and I want to get it right. Because when I was looking at first, because I'm just so excited to dig in, there's a piece of the nursing wellness as well. But am I hearing it correctly in that the first exploration was with these nurse practitioners exploring treatment for their patients, like psychiatric nurse practitioners exploring treatment for their patients? And am I hearing right? Then you started to open up or say, well, wait a second, this is for nursing wellness as well? Or was that part of the original vision as well?
Was pretty much the original vision, because I have known for many years that gaming was the way to go. So when I was and this was just a side note, when I was at HCA, I actually, my second business case was a $500 million business case that got approved to introduce mobile devices in the hands of nurses that could actually text, not using their personal phones, but using the provided phone from the company, right? Like, why were we using our data plans? And I would hear that all the time from nurses. They'd be like, well, I only have so many text messages. Remember back in the day before you admitted? This was real, right? This was 10, 15 years ago. And so, and they were like, I'm using up all my data because the doctors keep texting me. So
anyway, there wasn't a QWERTY keyboard either.
I was always fascinated with the impact that gamification and this whole mobile communication can have. So it's evolved into these immersive environments. And I did a publication with the dean of UAB, Karen Frith, and we focused on student well-being, mental health in the mind lab. So she had me do, like, what did we do here at Vanderbilt? And she was fascinated because she's a dean of a school of nursing. So we came together and we did this article, just, pretty brief, just describing, saying, hey, it's being recognized. Nurse suicide is real. There is a real thing out here that we are not paying attention to. Why is that something that we just go, it's kind of like veteran mental health. Why are we not recognizing the trauma that we have, that our nurses are experiencing in dealing with it? So this is our attempt, my attempt, Joellen's attempt, our attempt to be able to say, we want to give you space that you can come to and actually decompress for 5 minutes.
Really, Kelly, I have to interject this. It's so incredible that we're talking today, because today is World Suicide Awareness or Suicide Prevention Day. The other thing is that I recently lost one of my dear friends who was a CRNA to suicide. And it was something I couldn't figure out how to talk about. And so I can't tell you how timely this is, that suicide is not only on the rise with everyone, but with nurses, and that it's not a choice. It's not people giving up. It is a disease. Depression is a disease, and it is a sudden and silent killer. So this work is impacting me so much as you're talking, and I agree. And please continue, but I wanted to interject that because I didn't realize how very personal your work would become. That we're talking today is incredible, and the focus of your work is amazing and very personal right now. So I wanted to interject that, and I am exponentially more glad to be talking about this with you today. Well, like you said, it is real. It's touching, we are nurses and we are people, it's an epidemic on the rise, that's
It
really,
is.
shortening our lifespan, but nurses,
It,
right?
and
It's such a unique profession.
it is. And so, well, then good on us that we're talking about it today, because maybe somebody will hear this, and maybe if they are not comfortable, because when I was in training back in the 80s and early nursing and 90s, you did not speak about mental health.
Exactly. Me too.
You
Yes.
sucked it up,
At the same
Buttercup.
time.
You sucked it up, Buttercup, and you
Yep.
did what you had to do. Now, did that build resilience? I don't know where the breakdown. Let somebody else examine that. This is just my personal experience. I still have my besties, literally my nursing group, that we worked night shift together, that we used to pull pranks on one another in the night shift, in the ICU at Rush in Chicago. And we still, one of them was just at my house this last weekend. Like, we still are a group of, and you can't replace that nursing bond. But
Right.
our new generation of nurses, they're not finding that in the units, and they're leaving.
Oh, interesting.
Right? They don't have that collaboration. I can't explain it. I just know what I'm witnessing. And I know that for a fact, traveling nurse, I did traveling nurse back in the early 90s before it was cool. Well, now what is, right? It was, right, we went from Chicago to Hawaii. It was it was cool, but it was before it was cool. But what we're seeing now is we have this lost group of nurses who have become traveling nurses, so they don't have these bonds with these units in these groups to help with their moral injury, whatever you want to call it. And so some of them are reaching out to who are really in mental health crisis, and they have stepped away from the nursing profession, and quite frankly, they're dealing with these mental health crises and they're not going back into the nursing profession, and they're just kind of forgotten about. There's no need for the healthcare system to care.
Yeah.
Not taking care of the nurses. And so I feel like this Mind Lab is an opportunity to recognize what we were not willing to say before, which is you do need to take care of yourself, right? And so that's why so my slides, Bree, this is a side note. I think I might have said this to you. When I was at ANIA speaking, my final slides were not what were presented. And so I was really frustrated because I had that audience, and it was such an opportunity to say mental health is real. There are crises going on within our profession. We can help with technology and help you with this. I mean, is it going to solve it? No, but I know for a fact that gaming brings happiness and joy.
Yeah, I'd love to come visit. Do I have an open invitation?
Yes, you do. Of course you do. We're looking to expand this, and we just had, and this is, I'm just telling you my story. We have had more people come and want to visit the Mind Lab. But what's really interesting is that I have the nursing students, so we have different levels, pre-specialty, masters, doctoral students, and I see them come in and they go, oh yeah, this is really cool. And they'll put the headsets on and they'll do, one of the activities that we have in there. So the well-being. But what happened to me about 3 weeks ago is I went to my nurse practitioner for a checkup, and she said, oh, can this student, talk to you? Oh, sure. I'll take a student. What do I care? And so she was interviewing me, doing my history and all this kind of stuff. And then she stops and she goes, do you work at Vanderbilt? And I said, Yes, I do. And she had her little Vanderbilt thing on. I didn't tell her. She was in, she was an MP training for Vanderbilt. And she goes, I recognize your voice. And I go, oh, that's so cool. What about? And she goes, look, I went through your mind lab and it really impacted me. And what I did was I took the idea of meditation back to my unit, and we do 5 minutes of meditation before our unit meetings
It's great.
every time. And she goes, everybody loves it. They all love, she goes, we couldn't afford the headsets. And I'm like, who cares? She got the idea, right? She got the idea of doing something is better than doing nothing. And so I thought it was really cool. And I was like, that's cool, right? So
Yeah, that's impact.
yeah,
That's real.
so,
It's amazing.
so what, right. And so what it tells me is people want to do these sort of self-help, whatever, self-healing, whatever I don't know, whatever category it falls into. I'm not a psychologist, but what I know is I do see nurses in distress.
Yeah.
And I think that these little interventions of what I call prescribing technology from an informatics perspective is very powerful. And I am very excited to be able to bring this to students and faculty members so that maybe they can use this, just like that one student who told me, I mean, she couldn't have been there more than 10 minutes and she brought that back into her environment. So yeah, I think that's really cool.
It's amazing. It's groundbreaking. I love where it is and I can't wait to see where you take it. And I thank you so much for catching me up. And I'm going to be knocking on your door because I also want to be one of those many people who tours the lab and gets to experience it for myself. Kelly, thank you so much for your time. I appreciate you so much.
It's a pleasure.